Hello and welcome to Forever Response, a podcast from Emergency Services Times, sponsored by MSA Safety. I'm Catherine Levin and I'm the editor of Emergency Services Times. Joining Lanna on the pod is Alison Blakely. She's the Deputy Chief Paramedic for the London Ambulance Service. I met Alison at a recent event where LAS celebrated its 60th anniversary, and I knew then that she'd be a great guest for us as we seek to find out what makes leaders tick when they're in senior roles in large blue light organisations. 6 months into her current role, but 20 years into her career, she describes herself as a people person, always chatting away, and tells Lanna about what it takes to lead in a complex, high-pressure environment. Amazingly, London Ambulance Service receives 6,000 to 7,000 calls per day, and that's just to 999. And the service today is quite different to the one 20 years ago when Alison joined. And she talks about the complexity of demand in the healthcare system, with partnership and resilience key elements of that. She also talks about ambulance handovers, as you'd expect, and how in London they have created the 45-minute handover process. She shares the difficult conversations that involved with partners, but says it's working well now. Given the people focus that runs through this conversation, it's no surprise that she shares a lot about well-being, teamwork, and the need to be a flexible employer. Ending with a bit of future gazing, Alison tells Lanna about what the next 60 years may entail. And it's timely because Jason Killens is about to join them as the new Chief Executive. He also started his career in London Ambulance Service. So it's an episode full of insights, and it's a privilege for us to spend time with Alison. So sit back and enjoy as we hear from Alison and Lanna.
So today I am delighted to be joined by Alison Blakely, Deputy Chief Paramedic at the London Ambulance Service. Welcome, Alison.
Thank you so much. Great to be talking to you today.
Well, it is great to have you with me. So you've been with LAS for more than 20 years now, and I know you've seen the service probably change quite a huge amount during that time. So I'm really looking forward to hearing a bit about your journey, some of the challenges that you might be facing right now, and what the future looks like for London Ambulance Service. So let's start with your background. So as I say, you've been with the service for more than 2 decades. What first brought you into the world of ambulances?
Thank you. So probably a great place to start. So I, when I was 17, had an accident on a trampoline. I was at a leisure centre and landed badly on the back of my neck, and my legs went over and behind me, so I was kind of folded in a way that you shouldn't really fold as a human being, and immediately then couldn't move my legs. So I was picked up by an ambulance. It was a pretty difficult removal, and it wasn't one of the garden trampolines. It was a proper full-size trampoline. So it was fairly large, and quite a difficult removal to get me as a kind of 17-year-old girl off of the trampoline whilst keeping me flat and straight and not moving my head and my neck. And then I was blued into, or pre-alerted into hospital with a potential neck fracture. That was both terrifying, but also strangely exciting. And I remember saying to my best friend who I'd been with at that point, oh, maybe I should be a paramedic when I grow up, age 17. And it really stuck with me. And actually, I think the care and compassion that crew showed me when I was 17, quite frightened, didn't really understand what was happening, that care and that compassion really, really shone through. And I genuinely thought, actually, that's a job I'd love to do. So that's the job that I pursued. And here we are.
Wow, okay, what a story. So could you give us sort of a sense of your career path to date and then what led you to the Deputy Chief Paramedic role?
Yeah, absolutely. So I've always been interested in people. I've loved people and working with people since day one, really. Always been really kind of that people-y person, always chatting away. And so when I joined the London Ambulance Service as a paramedic, it was clearly a job for me. I walked in on day one and thought, this is absolutely brilliant. I joined through one of the first university cohorts. Now, if we fast forward to now, all of our staff go through a university programme to become a paramedic. But at that point in time, actually, it was quite unusual. It was quite a new thing. So I joined a university programme and then joined the London Ambulance Service. And initially, I was employed as an emergency medical technician whilst I did my degree. And then gradually, as I got more experienced and further through my degree, I then became a paramedic. And it really, really was the job for me and continues to be the job for me. And then from there, I moved into my current role as Deputy Chief Paramedic for the London Ambulance Service. And I've been in this role about 6 months. My role looks after, again, our frontline staff, our paramedics and clinical staff on ambulances. I also oversee a number of other teams. So I look after our specialist paramedics in primary care, our advanced paramedics in critical care and in urgent care. I look after safeguarding, professional standards and education. And that is where we've got to.
So leading a service, the size and the scale of London Ambulance Service is, I'm sure, no small task. How do you approach leadership in such a complex and high pressure environment?
Yeah, that's a really interesting question, and I've given this a lot of thought over the last couple of years, to be honest. Actually, it's really hard, and I think saying out loud that it's really hard is probably the first thing. So being really open and really honest that, we're a large organisation with thousands of staff. Not everybody is going to see me every single day of every week. And being really open about that, I think, is really important. But putting that to one side, for me, that visibility, being out and wearing other people's shoes, I feel like I'm in a really privileged position. And in fact, I am in a really privileged position to be in my role. I'm a decision maker, I have a budget. So within reason, obviously, I can make really quite significant decisions in my role. And I do make significant decisions in my role. But actually, for me, those decisions should be driven by the people that do the job every day. Because it's those people, it's our paramedics on an ambulance that know what some of the challenges are, but also know what some of our answers and solutions should be. So my stance is always listening to what our people say and really hearing what they've got to say and trying to translate that into some solutions, but also being honest that, it won't always go right. It won't always be perfect. It won't always be a great solution. But let's try it this way. And if it doesn't go right, let's try it a different way. That kind of honest two-way conversation has been my approach.
This episode of the Emergency Services Times podcast is sponsored by MSA Safety, proudly supporting emergency services and first responders on the front line. At MSA Safety, protecting first responders isn't just what we do, it's who we are. We work closely with fire and rescue services across the UK to develop and deliver safety solutions designed to meet your ever-evolving needs. That includes MSA Bristol Firefighter PPE, trusted by services across the UK and beyond, shaped through years of collaboration with frontline teams. It also includes our growing investment in innovation and technology, from the connected M1 SCBA modular solution to our agile, fully managed service model that helps keep crews protected and ready to respond. But for us, safety goes beyond equipment. We believe in standing shoulder to shoulder with the people who dedicate their lives to protecting others, whether it's supporting firefighter charities, backing mental health initiatives, or showing up for community events. MSA is proud to be part of the Emergency Services family. To learn more about our work in the UK and how we're supporting first responders every step of the way, visit www.msasafety.com. With MSA Safety, when you go in, we go in with you.
With services under that sort of constant operational pressure, how would you say you make space for that longer term thinking and the innovation?
So I think for me, it's about collaboration and working with other teams and listening, as I said a short while ago, listening to the teams that do the job. I spend a lot of my time talking to other people, and people might say, oh, you need to do less talking and more action. But actually, for me, I think talking and listening to people is really, really important so that when we do get to the action, it's the right action. So I work really closely. I have really regular catch-ups with a multitude of other teams across the organisation so that we're all sighted on things that are on our radars, things that are bubbling away, things that we'd like to focus on in the future, because no one team can do that alone. And so my way is always about how we collaborate across the organisation and across teams, but also externally. How can we collaborate and talk to external parties so that they're sighted on what we want to do and how we might get there, because they will have a part to play in that as well.
Really keeping that collaboration going.
Yeah, absolutely.
So, it's no secret that obviously ambulance services are really facing that sort of sustained levels of high demand. What does that look like day to day across London?
So it's safe to say we're quite a busy organisation in London. We see normally between 6,500 to 7,000 calls come into our control room each day. And that's just in our 999 service. Add to that our 111 service as well. It is a busy place to be. That said, actually, our response times and our ability to respond to our patients quickly has actually got better. I think we've learned quite a lot from our experience and the NHS's experience from COVID and how we responded to that emergency. And that has absolutely played a part in what our current model looks like. I guess the other thing that really is key here is that the ambulance service has changed. And if you look back 20 years, we would have taken probably 80-90% of our patients to an emergency department, drop them off, give a quick handover to a nurse, and then go and get your next patient. Actually, that's really fundamentally changed. And we no longer just do that as a kind of standard package for our patients. Actually, our clinicians right the way across the organisation are really, really skilled in doing a really detailed assessment, which enables them to then think differently and to think not just about taking a patient to an emergency department, but actually, can we keep this patient at home safely and refer them into another service? Could we get a follow-up call with a GP? Could we take them, yes, to a hospital, but not to an emergency department, and get them seen through a slightly different route? And all of those things, I think, help the system, but also help us, because the more patients we take unnecessarily to an emergency department, then see those delays that we've seen previously. So I think those parts are really key to kind of how we respond to that demand now.
And beyond the sort of volume, would you say you're seeing a change in the type of incidents that crews are responding to?
Definitely. So I think our demand has definitely gone up. But I think the complexity of that demand has also really changed. I think we now see a far greater number of mental health patients with really complex needs. And along with mental health needs, those patients will often have physical health needs as well. Our Our population is aging, which is brilliant. People are living much, much longer, but along with that comes patients who are frail and who fall, patients who can't necessarily cope in the same way that they did. And so those sorts of things have really added to the complexity of the calls that we go to, but also we've seen an increase in the volume of those types of calls. And I think the other thing that we have certainly seen are an increase in the volume of calls for more social needs as opposed to medical needs, and patients not really knowing who to call or how to get the help that they need, and us being one of those options. And that's certainly a trend that we've started to see as well.
Okay. And how is the service then adapting clinically and operationally to meet those changing needs?
So I think the way in which we've responded to that as an organisation, but actually I think all ambulance trusts to an extent, are things like the way that we will undertake an assessment of a patient over the phone before we send an ambulance. So our lower priority, sometimes really complex, but lower priority calls will get a phone call back from a clinician before we decide whether that patient needs an ambulance. That enables us to round about 20% of those patients are not sent a double crewed ambulance. And so that enables us to therefore save that ambulance for the higher priority complex patients who absolutely do need that response. So we've really focused on that model because the benefit that it brings to our patients, but also to us as an organisation and also to the wider NHS is really key. So that's a model that we've really focused on. And we've also been working externally with a lot of our partners, so doctors, nurses, community providers, in the early stages of setting up integrated care coordination hubs. That's a bit of a mouthful, but essentially it's about bringing a team of people together who are made up of paramedics, nurses, doctors, mental health specialists, lots of others, and bringing all of those together into a physical room and being able to talk through and navigate those patients that are coming into the 999 system to the right pathway, as opposed to just sending an ambulance. And that multidisciplinary, multi-team approach means that there are access to patients' notes, there are access to previous calls that have been made, potentially to GP records, and therefore we've actually got a much better understanding of that patient's presentation and what they may need from today's contact.
I'm really glad you mentioned the integration side of things there, because on a similar sort of topic, we obviously talk a lot about system resilience these days. So, the winter surges and then those unexpected events that happen. What does the London Ambulance Service role in that look like, especially when that pressure really ramps up?
Yeah, so again, I think that's really changed over the last 10, 15, 20 years. If I think back to when I first joined, the ambulance service was almost a kind of poor relation. We were a bit of an afterthought, and I guess done to. If I compare that to now, we're absolutely a really key system partner and are involved in all of those kind of strategic decisions and system plans from day one, and we do absolutely have a seat at the table to kind of form that direction, and we're absolutely seen as a partner as opposed to an afterthought. So I think that's a real change. As an example, we in London have had some challenges with ambulance handover, and we were seeing some of our ambulances really delayed for quite some time, having arrived with a patient, having clinically handed over that patient to the receiving hospital, but that hospital not having a bed availability for that patient And because the patient's on our ambulance or on our bed, actually that's an easy option, but actually B, safe for that patient. So that was totally understandable from a kind of system perspective, but actually from our perspective, once we'd arrived at hospital and we were ready to leave that patient in the care of the hospital and go to our next patient, actually not being able to do that was creating a risk in the community, because all the while we're at hospital, we're not able to respond to the next patient who's called 999. And so we worked right the way across London with all of our acute trusts to think about how can we manage this better. And we brought in a process which we have termed the 45-minute handover process, which essentially means we arrive at hospital, we give that clinical handover so that the hospital understand what's happened with our patient and what they might need, and then we wait for a bed. But if there isn't a bed that's become available, at half an hour, we'll have another conversation with that hospital, and at 45 minutes, we'll move the patient to a spare trolley bed and leave that patient in the care of the hospital, but with our bed back in our ambulance. And that created really quite difficult conversations. Hospitals found it quite difficult, but at the same time, I think the way that we approached it meant that they really understood why we were taking that line, and together right the way across London and with our regional colleagues at NHS England, we agreed this as a new process and gradually rolled it out. It wasn't a big bang, it wasn't a today we're writing this policy and tomorrow it comes in. It really was communicated, talked through, worked through with all of the hospitals right the way across London. And actually that has absolutely impacted on our ability to respond to patients and those higher acuity complex patients in the community quicker.
So we've talked a lot about operational pressures, but what about the impact on your people? How are staff coping, and how is the service supporting them?
So over the last couple of years, our service has really changed. And I think one of the greatest things that we've brought in across the organisation has been team-based working. Now that might seem really simple, that people work in a team and have a great day. Actually, it's much more complex than that. And what we've done in London is put everyone into a team of 15. So every 15 people have a team leader. And that team leader is then responsible for giving some updates to their team at the start of each run of shifts, but they're also responsible for supervision. They're responsible for update training, for update bulletins, and that kind of communication. And that alone has really seen our engagement skyrocket. And on the last staff survey, the NHS staff survey, actually so many people talked positively about being part of a team, which I think is really key. I think that has really supported our staff, but it isn't that alone. I think the other things that we've done have been about being really open about some of the challenges we've faced. So we've very openly written a number of charters that support our staff. So for example, we've got a sexual safety charter, we've got an anti-racism charter, and an anti-discrimination charter. And those charters have been developed by some of our staff groups and staff right the way across the organisation, but have been signed up to by our executive team for us to hold our line and hold that, set the tone, I guess, in terms of our expectations. And I think those charters, and there are a couple of others, have really kind of set our expectations in terms of how our staff feel, how our staff are supported, and building that culture of support and openness. I think one thing that's a positive was in fact something that came out of COVID, Not many positives came out of COVID, it has to be said, but actually that team approach and that working together ethos really came out of COVID. And I think that has been developed more and more since the COVID pandemic has left. Actually, the way in which we work together to try and find solutions, absolutely in a crisis, has continued. And I think those are some of the kind of developments that we've seen that were prompted by COVID.
And what about the career development side of things? What does that look like now for paramedics and call handlers? And how are you guys continuing to make the service an attractive place to stay?
So as a paramedic, I'm clearly very passionate about paramedicine and joining the ambulance service. I think from a progression perspective, we've now got a great career pathway from entry point into the organisation all the way through to being Chief Paramedic from a clinical perspective. But actually it's wider than that, I think. And there are really clear pathways now for non-registrants and non-clinicians as well, right the way across the organisation. We've got a number of apprenticeship routes, both clinical apprenticeships and non-clinical apprenticeships, which are clearly very popular and bring great benefit to individuals who get that education, but also learn whilst they're on paid employment, and bring great benefit to our organisation. We've also done a huge amount of leadership training with our first line managers and leaders above those, really thinking through how do you lead a dispersed workforce across multiple sites, staff that you don't necessarily see every day. How do you provide that leadership, and really focusing on being a good leader and the impact that that has. And we've worked quite closely with a number of universities to work on some of those programs. And then I think one of the other things that we're really proud of, and I'm certainly proud of, is thinking flexibly. So our staff, a lot of them are young, a lot of them have families, and actually thinking flexibly and thinking differently about how those staff can have their family, can have their life, but actually can still work for us as a paramedic or as a non-clinician in another role in the organisation. Actually thinking differently, I think, has been really good over the last few years as well.
Yeah, that's really important, because everyone does have lives as well. So I love that you've mentioned that.
Definitely.
So this year you guys mark 60 years. And I'm sure that was an amazing chance to really reflect, but also to look ahead. What would you say the next chapter looks like?
So I think if we look back over my last 20 years, but also over the last 60 years, the way in which we as a service has grown has been phenomenal. Actually, paramedics didn't even exist 60 years ago. And so I think recognising that and seeing how far we've already travelled makes the future look really, really exciting. I think for me, it's no longer just about responding to really high acuity, really sick patients. I think there's something about our work in how we can do some prevention. So obviously in London, we have a fairly high knife crime statistic. Actually, I think we've got a place in that world, thinking about how we can do some education and really focusing on that prevention area. We in the London Ambulance Service have recognised ourselves and are recognised as an anchor institution for London, so a really key employer, but a really key part in how London runs and how London works. And actually, as part of that, it's about representing the NHS and representing our organisation, and equally how London is represented by our organisation. And I think those are really key focuses for us as we move forward. I think one of the other really exciting developments over the last couple of years has been our focus on health inequalities. So again, we see a number of patients that potentially other healthcare providers don't ever see. We go to patients in their own home. Again, a clinician who's based in a hospital won't necessarily ever see their home, so don't know what their home is like. We have a really unique lens and therefore a really unique role, I think, in recognising health inequalities and our part in addressing some of those health inequalities. One thing that we've done over the last couple of years in that space has been identifying what's been termed as defib deserts. So parts of London that actually don't have a public access defibrillator, but also the data about the number of people who go into cardiac arrest in that area and where those cardiac arrests happen, whether it's in a public place or a private residence. So we've used all of that data and then worked with charities in London and our own charity to start providing and putting in place defibrillators in those areas where there isn't already a defibrillator, but also where we know that cardiac arrests happen more frequently than other areas. And then to go with that, we've also done a huge amount of work in schools in those areas to do defib training and CPR training for school children.
Amazing. And just finally moving on to advice for our listeners. So what piece of advice would you give to someone who's perhaps in the early stages of their ambulance service career? Maybe that's on the road or in the control room or anywhere else within the service.
So my advice, I think, would be stick to your guns. Think about what it is that really drives you. What is it that you're really passionate about? And what are the lines that you're not really willing to cross? So mine were about being able to be me and being values driven, which I absolutely am. Being involved with teams and other people, having the patient right in the middle of every single role that I've ever done, were the three things that I really wasn't willing to compromise on. And I've held true to that throughout my career. And then I guess on top of that, what are the things that really drive me? What are the things that have really interested me? And I've got some experience across my career of all of those things. And I guess I've tried and tested bits and bobs across the years and really thought through, is that the career that I want, or is it something slightly different to that? And actually, I guess not pigeonholing myself to one specific area of one specific role too early, actually thinking a bit broader about the things that really drive me and my passions.
That is some great advice. Well, thank you so much, Alison. That was an absolutely brilliant conversation. Really appreciate your time and your insights, and I know that our listeners will take a lot from this. So I hope to see you at the Emergency Services show in September. And that just leaves me to say thank you again, Alison, for joining me today.
Thank you so much.
Thanks for listening, and thanks to Tom St. John for expertly producing this episode. If you like this episode, then be sure to check out other conversations with leaders in this season of For Every Response, sponsored by MSA Safety. Share the link and subscribe to receive updates on new episodes from us here at Emergency Services Times.